So I'm going to give you 8 things that you need to know to make sure plastic surgery is right for you. So please be sure to stay tuned to the end because I might just add a little bit of bonus for you. All right, let's jump straight into this list. So at number 8, we have options. So when you're thinking about plastic surgery, there are so many options. Like there are so many ways to skin a cat. You may decide you want to get saline implants instead of silicone implants. You may decide you want to get fat grafting to your breast instead of getting an implant at all. So first and foremost, you got to know the options. So do your research, find out what your friends are getting, go look at your surgeon's website and see what type of options they offer. All right, so with that being said, let's get into number 7. Number 7 is plastic surgery is not without risk. So whether you in the operating room under general anesthesia or you're in the office and you're getting Botox, there are risks associated with plastic surgery. Some of them are minor and can be managed in the office, and some of them are complicated. Then you may need to be admitted to a hospital. Ultimately, I mean, you can lose your life, so it's something to take seriously. All right, so we're gonna keep it going. We're at number 6. Now, number 6 is the money, the pricing. So, prices vary depending on your surgeon's reputation, where you're going and what you're getting done. So you gotta get your bag right. You gotta have your money together, whether you paying for it, whether your baby daddy paying for it, whether you got your little side piece, whatever it is, somebody has to pay. Whether you paying cash, whether you have to work and put that stash to the side, or you get financing through Care Credit or Alpheon, you gotta have your money right. It's important. All right, we're at number 5. So number 5 is more surgery. So what do I mean by that? So sometimes when you have plastic surgery, you may not be able to get it all done at once, especially if you're a massive weight loss patient. It would be damn nearly impossible to get your whole body done. And so sometimes it has to be broken up, it has to be done in stages, and so you have to make sure you go to the right surgeon and make sure it's done in a proper way, or you have to take into consideration your lifestyle, your occupation, and figure out what's best for you, because what may be right for someone else may not be the right sequence for you. All right, we're at number 4. Number 4 is the recovery process. Now, this is so key because it really depends on what surgery you're having done, and the recovery process for each and every individual patient is different. So for some people, you may need to be a couple of weeks out of the office, or for others, it may be a month. It really depends on your overall health and the procedures that you're getting done, who you're going to need to help you recover, whether or not you need to stay in a recovery house, when you can have sex again. For men, when can I get back in the gym? All these things have to be taken into consideration so that you get the best possible result. Because if you don't have ample enough time to recover, you're going to compromise your result. For BBL patients, staying off your butt. For patients who get lipo, wearing that garment for at least 3 months. All these things are important. So sex, and generally, especially for patients who have more invasive procedures, I usually say like around 4 to 6 weeks. And the reason that is a generalized number is because it takes about 4 to 6 weeks for the tensile strength of the healing process to be at its max. And so at that point, then it's probably okay for you to have a little bit of trauma, a little bit of banging on the body, because your body can tolerate it. Okay, we're getting to the top 3. We're at number 3. Now number 3, you gotta pick the right surgeon. You gotta pick the right plastic surgeon for yourself. So just like any other field or industry, there's professionals and there are people who are great at one thing. There may be someone who's great at BBLs, but they may not be great at arm lifts. Or they may be really great at breasts, but they don't really do any facelifts. So you have to pick the right plastic surgeon for yourself. Things that you want to take into account: their experience, their location. You can go look at the before and after results, and then more importantly is the actual interaction, your interaction with that plastic surgeon. So whether it's an in-person visit or a virtual visit, you gotta feel that vibe. You gotta feel that connection, because at the end of the day, you are placing your life in their hands. And so you have to have a certain level of trust. And if you don't have that trust, it's probably not the right person for you. All right, number 2, plastic surgery is not a weight loss operation. Plastic surgery is not for weight loss. Yes, I have some patients who have high BMIs and they want a little lipo. Yes, I'll do it, because for some patients, the lipo is actually seeing a difference, a change, can inspire them to do more. So when you're thinking about having plastic surgery, again, this is not a weight loss option. You have to maintain a certain lifestyle. You have to exercise. You have to control and moderate what you eat so that your results are long lasting. Like, I've had patients, they've come in and they've had plastic surgery, or I've done their lipo, they had their tummy tuck and they've gained weight. And so because I care about you as a person, I want to do what's best for you. Like, I have patients who have high BMIs and they come in, they say we want to look like Kim K, they want to look like Jada Waiter. So you may not have that same body frame, but hey, let's get you to lose some weight before you undergo the surgery so that you can get the result that you want. There's a lot of plastic surgeons who will just take your money. And that leads me into number one. So if you're not healthy, you can't even have plastic surgery. Like, if you're diabetic and you're morbidly obese, you have uncontrolled hypertension, you're not even a candidate for surgery. Because the last thing that I want to do as a healthcare provider, as a plastic surgeon, I don't want anybody to die on the operating table. I don't want anybody to have a complication. I want you to safely have a surgery. So what does that mean? If you do have some of these underlying medical conditions, let's optimize them. Let's go and get a tune-up. Let's go and get that oil changed. Let's make sure we have done everything that we can possibly do to make sure you are safe to have surgery. Because despite all those efforts, there are still some patients who are going to have complications. There are still some patients who may end up losing their life as a result of having surgery. So I don't want that on my head. So I want to make sure that you're safe. I want to make sure it's safe for you to have surgery. I want to make sure that you didn't have a heart attack 3 months ago and you come in my office and you say you want plastic surgery, or you had a stroke, or you have sickle cell anemia. So you have to be honest with me. You got to tell me all. If I ask you a question, I need you to be completely transparent, because everything that you say or do has an impact on what I may be able to offer you. So again, number 1 is your overall health. You have to be healthy in order to undergo plastic surgery. If I turn you down, if I say, hey, you're not a candidate for this surgery because of your underlying health, and you go run across the street to another plastic surgeon or to a cosmetic surgeon and they say, yeah, I got you, you need to really think about that, because they do not have your best interests at hand. All right, so it looks like you stayed to the end, and I said I had a bonus for you. Well, here it is. And the bonus is realistic expectations. So if you go and you have plastic surgery, or you come in to see me and you want to look like Jada Waiter, but you not starting at you don't have the same foundation as Jada Waiter, or if you weigh 230 pounds and you're looking to have a result of someone that weighs 130 pounds, that's just not realistic. So for each and every individual, you have to come in and you have to have realistic expectations. Like, the results that you expect have to be within a certain reach or a certain range so that we can work together. And if we can't really come to an agreement, then you're probably not a good candidate. So basically what that probably means is that you aren't the right patient for me, and I'm not the right plastic surgeon for you. All right, thanks for watching. I hope you enjoyed, and I hope this gave you a lot of value and you're able to decide if plastic surgery was right for you. And if you want to know what the top 5 trends in plastic surgery are for modern women, watch this video next.